Although Wednesday marked the end of Alzheimer's Awareness Month, concerning trends related to the disease are staying top of mind for medical professionals and lawmakers.
The Alzheimer's Association says many living with the disease never receive a diagnosis, and 87% of primary care physicians expect a surge in the number of patients needing treatment. Now,
one of our fellow Midwest states is taking the lead in advancing care for Alzheimer's patients with a first-of-its-kind law headed to its governor's desk. KIMT News 3's Anthony Monzon reports.
I love talking about my mom, Velma. She was a beautiful woman inside and out.
Velma Wiggins was a lifelong educator in Illinois, also the mother of Juliana Stratton, now the lieutenant governor of the state. Wiggins lived with her daughter for more than a decade before her passing, during which time the future lieutenant governor was surprised to be approached by a family member about having her mother evaluated for Alzheimer's disease, leading to a formal diagnosis.
My mother had been living with me and my family, and none of us saw the signs because maybe she was so close.
Wiggins regularly visited her doctors, Stratton says, and they too missed the signs of Alzheimer's. Nevertheless, years of caregiving remained ahead for Stratton, a truly eye-opening experience.
It was really the greatest honor of my life to care for her after she was diagnosed with Alzheimer's. I'd do it again if I could, of course. But I also recognize that it was challenging being a caregiver. You know, you look at your parents and you want them to always be those strong people that you have known throughout your life, the ones who cared for you. And when those tables are turned and you have to care for them, it can be very stressful.
The challenges of diagnosing and caring for those with Alzheimer's were yet more lessons the former educator passed on to her daughter, ones that would stay with her all the way to the Illinois State House, with Stratton leading the charge in passing a first-of-its-kind bill requiring continuing education on Alzheimer's and other forms of dementia for nearly all healthcare professionals who interact with patients 26 and older.
Even though there's no cure, there's some things that can happen when you have a diagnosis. First of all, if it's earlier, the person can have greater input to their own healthcare plan. Secondly, as I've mentioned, the families can have more time to kind of plan financially and otherwise. Who's going to do what and how are we going to pay for it? And then sometimes people, if it's early enough, can also participate in clinical trials.
Anthony Monzon has reached out to Lieutenant Governor Flanagan's office regarding whether a similar bill might make a difference in Minnesota, but has yet to receive a response.